everyone. This is Amanda Guzman. I'm going to be doing the presentation for Group 3, and that is for myself, Adriana, Natalie, Mitra, and Kavni. And our case study is about Chris Bowman, who is a patient with asthma and high caries risk activity. I'm just going to move this to the top. All right, this is a picture of Chris. So he is a 5-year-old male patient who presents to the dental office with severe caries. His recent past medical history includes presentation to the emergency department with symptoms of coughing, wheezing, and increased shortness of breath. He's been diagnosed with asthma, and he was prescribed an albuterol rescue inhaler. He appears to be in good health overall. He's very chatty. His vitals include a respiration rate of 28 breaths per minute and a heart rate of 103 beats per minute. Oxygen saturation is 98% on room air. His parents have presented to the dentist's office with Chris, with the chief concern being his rotten teeth. Chris's parents are very interested in addressing this issue. His blood pressure is 140/70, his height is 94 centimeters, and he weighs 31 pounds, and he is considered an ASA Category 2. So asthma medications and dosing. Asthma medications are anti-inflammatory agents like corticosteroids that suppress the inflammatory response. They can be preventer, reliever, or controller medications. Asthma drugs are used to reverse bronchospasm, and asthma reliever medications include beta-2 agonists and anticholinergics. For Chris's medications and dosing, he takes Qvar for the treatment of chronic asthma. That is a corticosteroid inhalant, can be used for rescue as needed. 40 micrograms is the dosage twice daily. You should monitor for hyperglycemia, signs and symptoms of adrenal insufficiency, oral candidiasis, caries, xerostomia, hypomineralization of teeth during development, as well as height and things of that nature. Advair discus is fluticasone propionate, 100 micrograms, and salmeterol, 50 micrograms, one inhalation twice daily for maintenance. Dry powder does contain lactose, which can lead to caries if it is not properly rinsed out. Albuterol was recently prescribed by the emergency department at the recent emergency visit. All of the medications and its usage are strictly monitored by Chris's mom. Chris's last dental exam was when he was 4 years old, approximately a year ago. And at that time, he had no prior radiographs, no diagnosed asthma. He received a prophy, had no history of dental anesthesia, and at that time, there was no restorative treatment needed, so a lot has changed since his last visit. And upon extraoral examination, it was noted that he appeared to be very excited and talking a lot. It was also noted that he was exhibiting slight shortness of breath with any exertion. Chris presented with mild facial flushing and no signs of lymphadenopathy nor TMJ deviations. And on intraoral examination, Chris exhibited signs of xerostomia. He exhibited caries in all of his molars and his canines, but no oral sores, no petechiae, no swelling, or other conditions were noted. His palate and tongue were examined and appeared normal, but the inadequate salivary flow was detected upon inspection of his salivary glands. Some other relevant findings, his plaque index was at 72%. The plaque distribution was generalized on all of his teeth, but they did have a thicker distribution of plaque on the cervical thirds of the teeth and interproximally. His calculus distribution was moderate and mostly localized on the linguals of his mandibular anterior teeth and the buccal surfaces of his maxillary molars. The bleeding index was 30%. Topical anesthetics were not used at this appointment. And even though Chris is young, he does notice that his teeth look different than his friends, and the appearance of his teeth do bother him. So the patient's mom brushes his teeth twice a day. Mom, however, did say that she does not floss his teeth because she thought he was too young. Chris is not able to floss or brush independently. His parents and Chris, obviously, are not tobacco users. Um, Chris's mom states that she makes sure that Chris consumes a healthy diet and states that no sodas are allowed at home. He does enjoy sweets and is allowed one piece of chocolate following lunch each day. And they were given oral hygiene instructions, which included the modified BASS technique to remove plaque and biofilm adjacent to and directly beneath the gingival margin. We recommended that the patient's mother start flossing him immediately, at least once a day herself, and to also encourage and teach him to use kids' flossers to remove plaque buildup interproximally. The directions were to use the kids' flosser in the morning in front of a mirror and slide the floss in between each of his teeth interproximally to remove the buildup. At nighttime, his mother was instructed to use a regular floss and insert the floss interproximally and make a C shape and hug the tooth and move the floss in a vertical motion and slide underneath the gingiva gently to clean the biofilm attached to each tooth. We instructed his mother to use a small pea-sized amount of the fluoridated toothpaste and spread it over the ends of the filaments and brush his teeth. Um, and instructed him, sorry guys. There we go. And instructed him not to swallow an excess amount of paste. I'm sorry that got cut off. But now that was actually at the perfect time because we are going to have Natalie continue with some questions about our case. Thank you guys so much.
Hi everyone, this is Natalie Lobo and I'll be presenting the questions for the case study of this project. We'll start with question number 1. Which one of the medications on Chris's medical history can cause possible carious lesions and why? A. Qvar for the treatment of chronic asthma, corticosteroid inhalant, rescue medication. B. Adviar discus, fluticasone propionate 100 mcg, salmeterol 50 mcg, inhalation twice daily for maintenance. C. None of the above. D. Both A and B. Answer is D. Both A and B. According to the National Center of Biotechnology information, all dry powders contain lactose, which can lead to caries if not properly rinsed out. Question 2. What is the main reason for Chris to present with many numbers of dental caries? A. Daily chocolate intake. B. Not flossing daily. C. Xerostomia. D. Not having prior dental cleanings. Answer is C. Xerostomia. According to the textbook Oral Pharmacology for the Dental Hygienist, patients taking B2 agonist LABA bronchodilators are an increased risk of having xerostomia, and that is the main reason for dental caries in this case. Question 3. What guidelines must be used for our patients' regular visits to prevent from adverse effects of systemic corticosteroids? A. Monitor the patient's salivary flow. B. Monitor the patient for oral candidiasis. C. Frequent oral prophylaxis. D. All of the above. Answer is D. All of the above. According to the textbook Oral Pharmacology for the Dental Hygienist, systemic corticosteroids are an increased risk of having oral candidiasis, xerostomia, stressful dental visits, and gastrointestinal problems. Question 4. Which statement is correct? A. You can use both hand instrument and ultrasonic scalers on an asthma patient. B. You can only use hand scalers on asthma patients. C. You may use an ultrasonic scaler when performing SRP on asthma patients. D. Both A and C are correct. Answer is B. You can only use hand scalers on asthma patients. According to the College of the Dental Hygienists of Ontario, use of air polishers, power-driven polishers, and ultrasonic scalers should be avoided or minimized because their use may precipitate or worsen breathing problems or result in pathogen aspirations into the lungs. Tooth enamel dust and aerosol creation should be minimized. Prolonged supine positioning should be avoided. Question 5. What are some of the adverse effects that Chris might experience by using albuterol? A. Nausea. B. Frequent nervousness. C. Frequent urination. D. A and B are correct. Answer is D. A and B are correct. According to the American Academy of Pediatric Dentistry, the adverse effects of using albuterol are transient tachycardia, tremor, nausea, less frequently nervousness, and palpitations. Question 6. Psychological disturbances have been shown to be more common in patients with severe asthma than in healthy children. Asthma medications also have been associated with behavioral, affective, and neuropsychological changes in children. A. First statement is correct, but the second statement is incorrect. B. Both statements are correct. C. Both statements are incorrect. D. First statement is incorrect, but second statement is correct. Answer is B. Both statements are correct. According to the American Academy of Pediatric Dentistry, psychological disturbances have been shown to be more common in patients with severe asthma than in healthy children. For example, Ms. Rack found that 25% of severe asthmatics suffered from emotional disturbances. Asthma medications also have been found associated with behavioral, affective, and neuropsychological changes in children. Patients were found to be easily tired, argumentative, irritable, and sad when receiving steroids. Question 7. Barbiturates and narcotics should be avoided in children with asthma because of their potential for stimulating histamine release, which can lead to bronchospasm. A. The statement is correct, but the reason is incorrect. B. The statement is incorrect, but the reason is correct. C. Both the statement and the reason are correct. D. The statement and the reason are incorrect. Answer. Both the statement and the reason are correct for C. According to the American Academy of Pediatric Dentistry, if conscious sedation is required, hydroxyzine, which has antihistamine and sedative effects, and benzodiazepine, which are anxiolytic and do not induce bronchoconstriction, are usually recommended. Barbiturates and narcotics should be avoided in children with asthma because of their potential for stimulating histamine release, which can lead to bronchospasm. Question 8. Which of the following steps should be taken to manage an acute asthmatic attack in the dental office? A. Administer oxygen. B. Open the airway. C. Seat the patient in a comfortable position. D. All the above. Answer is D. All of the above. According to the American Academy of Pediatric Dentistry, the following steps should be taken to manage an acute asthmatic attack in the dental office. 1. Discontinue the dental procedure and allow the patient to sit or lie down in a comfortable position. 2. Keep the airway open and administer B2 agonist with inhaler or nebulizer. 3. Administer oxygen via face mask, nasal hood, or cannula. 4. If no improvement takes place and the patient is worsening, administer epinephrine subcutaneously and summon medical assistance. Question 9. Which statement is correct? A. Patient with asthma are highly recommended to brush immediately and rinse with water after using inhalers. B. Patient with asthma should do oral rinse immediately after using inhalers. C. Patient with asthma should avoid using their mouth after using inhaler. D. None of the above. Answer is B. Patient with asthma should do oral rinse immediately after using inhalers. According to the College of Dental Hygienists of Ontario, immediate brushing of the teeth after using an inhaler should be avoided because it may damage enamel already weakened due to acidic pH. Question 10. A major risk factor and the pathophysiology of asthma in children. A. Bronchial inflammation. B. Irritation of the lungs. C. Inflammation of the trachea. Answer is A. Bronchial inflammation. According to the American Academy of Pediatric Dentistry, the pathophysiological factor in asthma is bronchial inflammation. Question 11. A practitioner should consider the following when verifying how the disease is controlled. A. Vital signs, BP, heart rate, and respiration rate. B. Frequency of asthma attacks, types of medications used during both acute and chronic attacks, and last time an attack was taken place. C. Frequency of asthma attacks, type of medications used during both acute and chronic attacks, and first time an attack occurred. Answer is B. Frequency of asthma attacks, type of medications used during both acute and chronic attacks, and last time an attack was taken place. According to the American Academy of Pediatric Dentistry, the patient should be asked several questions to verify how the disease is controlled. These questions help the practitioner evaluate the patient's health and to be prepared for future procedures. Question 12. What medications can be used on a patient who has asthma? A. Aspirin. B. NSAIDs. C. Acetaminophen. D. None of the above. Answer is B. Acetaminophen. According to the School of Dentistry at the University of Washington, it is best to avoid aspirin, NSAIDs, and other salicylics as it may provoke a severe exacerbation of bronchial constriction. Acetaminophen is highly recommended. Question 13. Children with asthma often have good oral hygiene than children without asthma. The amount of corticosteroid in an inhalant increases the impact of caries on the primary dentition. A. Both statements are false. B. Both statements are true. C. First statement is false, second statement is true. D. First statement is true, second statement is false. Answer is C. First statement is false, second statement is true. According to an article from Dimensions of Dental Hygiene magazine, children who have asthma have poorer oral hygiene than those who do not have this condition. The second statement is true as the medication can cause oral candidiasis and dental caries. Question 14. What type of medication is the asthma medication albuterol? A. A B2 agonist. B. A B2 antagonist. C. A B1 agonist. And D. A B1 antagonist. Answer is A B2 agonist. According to the textbook Oral Pharmacology for Dental Hygienists, albuterol is a B2 agonist. Question 15. For patients taking albuterol, patients should not be prescribed at-home fluoride treatments for persistent dry mouth. Patients should, however, use salivary substitutes if dry mouth is persistent. A. Both statements are true. B. Both statements are false. C. The first statement is false. The second statement is true. D. The first statement is true. The second statement is false. Answer is C. The first statement is false. The second statement is true. Patients may need daily fluoride treatments at home if dry mouth is persistent. Patients should use salivary substitutes if dry mouth is persistent. For this, we concluded our questions for our case study for our project. The next slide is our references. Thank you so much for tuning in.